From the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here with you on a Wednesday. How's your morning going? It's going great because you're watching us right now, and that's awesome. We're going to put the phone number up in a second. You know, yesterday we had our friends from Social Security on talking about a lot of the issues there. Several of you called in, some of you inquiring about, Advantage plans, Medicare enrollment, health insurance in general. And, we referred you to, among other agencies, SHIP here in the state of Tennessee. And I'm going to let our guest this morning, who's with SHIP, explain what they do and how they can help you. And this is a great opportunity for you to call in because health insurance is a big issue for a lot of people, and they help many of you. So the number will go up on the screen in a moment. But first, let's get you some information on SHIP and maybe give you an idea of what questions you can call and ask of our guest this morning. Shannon Jones, good morning to you.
Good morning. Thanks for having me.
Nice to have you on. And all right, so SHIP has been coming on this show for several years. It's been a while since we've had you guys on with me. But okay, SHIP stands again for
the State Health Insurance Information Program.
Okay, this is something funded by the state?
It's actually a federal grant.
It's a federal grant.
Yes, from the Community on Aging and Living.
Okay.
And we are funded to help folks across the nation. Mm-hmm. Ours is for Tennessee.
Right. Okay.
But there's a SHIP in every nation. And
every state, you mean? Yeah.
Yes.
Every state.
Every state.
Throughout
it's
the
nationwide.
Nation. Yeah.
But we help folks understand their Medicare benefits. We are not associated with insurance companies or any products, and we work really hard not to even give the appearance that we endorse any. Mm-hmm. It's strictly to help Medicare beneficiaries make appropriate decisions for themselves.
Okay, so it's not political, we know that. It's nonpartisan.
Right.
You're not representing, or you don't have some hidden agenda where you're going to try to push clients to a specific plan or something
Correct.
like that.
No.
Which is, it's just fantastic. So these are people you can call and trust. Now, all right, when you talk about this, and I think some of our viewers will have a handle on what you can do, they'll understand what you mean by that. But what are the typical questions you get? And again, let's hit this at the top because Obamacare is in the news again. It's a political season, of course. You're not dealing with Obamacare because that is for folks before they get to Medicare Age.
Correct.
Medicare Age now is depending on, I guess, what is it now? Same as Social Security. Is it 60?
No, it's still 65.
It is still 65.
Yes, it has not changed with your Social Security retirement benefit.
Okay, I didn't realize that. So it's still 65. So that's basically most of the people you're dealing with are those 65 and above, or their families helping them out, right?
Yes, or if someone has been deemed disabled through Social Security.
Okay, SSI.
And after 24 months they are eligible for Medicare benefits, then we can also help them.
Is that it? I'm trying to think anything else beyond
that. One more group,
okay,
end-stage renal disease.
Okay, all right.
If someone has that at any age, then they would be eligible for Medicare.
All right. Why do you think SHIP is needed? Is it because it's just so darn confusing?
That is the primary reason.
Okay.
Because I've had several college professors that are aging into Medicare, and they tell me, I have a PhD and I don't understand this. Mm-hmm. How can just anyone average understand it? And it is difficult. And one of the things that we do, we have staff across the state that help. So you have a local office that you can go to, but we sit down and look at that person's scenario. Are they turning 65 and going to continue working? Those decisions are completely different than someone that's turning 65 and going to retire. Do you have TRICARE? Do you have federal employee health benefits? Will you have retiree through your company with health care? And those types of questions we work through so that the person can make the best decision for them.
Let me ask you this, just it's real basic stuff. We all eventually get to deal with Medicare, I guess. Now, right, when I get to be age 65,
yes.
Okay, at that point, I may or may not still be working. Let's assume at age 65, let's say I retire at 65, and so I leave my place of employment, and I know, and that's where I have my insurance now, and I'm done at that point. Okay, and I'm 65. What am I entitled to as a senior 65 and above? Right when I retire, what can I do at 65?
So when you're turning 65, that starts your initial enrollment period.
Okay.
So you have 3 months before you turn 65, the month of your birthday, and then 3 months after for that initial enrollment period. Decide whether you want Part B, or Part D for prescription drug coverage, and a Medicare supplement policy.
Does everyone apply for Medicare? Now, if I just have a great private insurance plan and do I still go on Medicare?
You do, because if you do not enroll in Medicare when you are eligible to enroll in Medicare and later decide to go in,
you want it,
there's going to be financial penalties.
And Medicare, you pay a certain amount as you go, correct? That's why we have, but it's still, it's the whole idea of it. I'm just talking in big, broad terms here, okay? Basic stuff for a lot of folks that probably have a handle on this. Medicare is in place to provide, when you're in your later years, a form of health care for you that is affordable. Would you put it that way?
It
Or is
can
accessible?
be,
Okay, yeah.
and that's why it's important to really sit down about your personal situation.
Okay.
Because everyone will eventually pay for Part B,
Which is
for medical services,
Okay. Like
and
going
that is a monthly premium.
to the doctor.
Yes.
And all that. Okay.
Currently, the majority of people are paying $104.90, $104.90
Okay.
for their Part B premium
A month?
A month.
Okay.
If they are new to Medicare in 2017, they'll pay $121 a month.
Okay, but that's way less than I would pay now if I was on private insurance.
And that's just one part of it.
Okay. All right. No, then there's the
So you need drug coverage.
Drug coverage. That's Part D, is that?
Yes, that's
Yeah.
Part D. It's the only one that matches, D for drugs.
Okay, and so the drug coverage, and that's sometimes where when we talk about Advantage plans, which is what they can help you a lot with, or supplemental plans, right? What do you call those?
Well, the Advantage plan is not a supplement.
Okay. It's not.
It's separate.
Separate. All right.
Yes.
I want to get the terms straight here.
Yeah.
First of all, when you get on Medicare, it doesn't mean you have to buy a supplement, do you?
If you are going to stay in original Medicare, which is Part A, Part B, and D, then you'll need a supplement for the 20% copays and deductibles that you'd be responsible for.
But you're paying for the supplement. I don't get it. Why? Why not just pay the 20%?
Well, think of what going into the hospital and having surgery, and the bill's $50,000. 20% of that could wipe some people out.
Okay.
And that's just one time.
And so you get a supplement which you're paying on, and the supplement companies are banking that you're not going to have a $50,000 bill, right?
I don't know about that.
Well, then how do they make money?
But it's the risk pool. They want healthy 65 and older folks to compensate for those that aren't so healthy. Just kind of like car insurance. You got good drivers and bad drivers.
Makes sense. You're so good at explaining this. I know these are stupid questions, but I'm trying to get a handle on all of this. And all right, listen, if you would, and we'll take our break before we get to some calls, and some are coming in, 737-7587. But if you would, for the viewers that are watching now, give them an idea of how you might be able to help them. What type of most common questions that you think maybe some of them are dealing with, so they can know to call in and maybe ask? What are the ones that you help most with?
So what is happening right now is that it's Medicare's annual open enrollment. It started October the 15th and it goes through December the 7th. And this is the time that you want to see if your current drug coverage, either through a standalone prescription drug plan or through an Advantage plan, is still going to be the lowest cost plan for you in 2017.
All right. Meaning what you're saying is that there are a bunch of different plans out there, and some are going to cover some things that others won't, and you have to look at your individual situation and decide, all right, I'm on these drugs. I need to find a plan that covers these specific drugs, right?
Right. And for couples, it's very rare that the spouses are on the same drug plan or even the same Advantage plan, because it all depends on what prescription medication each person is taking.
Gotcha. Okay. And so couples together. What other, before we take our first break, aside from looking at the drugs that match up, are there certain plans that allow you to go to certain doctors that wouldn't let you to go to others, or different healthcare facilities? What are the other factors that come into play when you match up for yourself?
That's very important. So if you are in an Advantage plan, or you're going to be new to Medicare and you're going to enroll, you want to call your primary care doctor, any specialist that you're going to, the hospitals that you want to go to, and the pharmacy, to make sure that they are all in network, because Advantage plans are set up like employer coverage. You have in and out of network. They offer the same thing as original Medicare, but their copays and deductibles may be a little bit different. And so we also show can show people the difference on those ends. On if they go out of network, they would be responsible for X amount, but if they go in network, their copay is only $5. So it's very important to look at that.
If you're talking about a senior, you know, sometimes they may have had a doctor for a long time that they want to stick with, but if they find a plan that is great for their drugs and is going to bring it way down, but maybe their doctor's not in that plan, then they have to decide, do I want to switch doctors? Which, yeah, switch doctors, but some people have that trust built up, or no, I'm going to stay with this doctor and I'll take this other plan where I'm paying a little bit more for my drugs, but I get my doctor. Those are the kind of things
you got it.
And you guys can help walk them without advocating one way or the other. You can just tell them, these are your choices.
Right.
You stay with this one, you're going to pay more for your drugs. Okay, but you can go to your doctor. You go here, you're going to pay a lot less for your drugs, but you're going to have to choose a different doctor, things like that.
That's exactly what we do.
All right, let's take a break on that. We'll go over to more of the other stuff. It would be nice to have someone help you go through that. 737-7587 is the number. Cindy and others, if you're on hold, stay there. We'll get to your calls. But if you have any questions this morning, specifically or really for Medicare, you know, she can answer and help. We'll put out phone numbers for you at the end of the show on how to contact them as well if you have a more detailed question to get the ball rolling. But yeah, as she said, right now it's open enrollment. Get on it. You may have been on a plan last year that you thought was awesome, but there may be a better one out there, and at the very least you can explore that option. So we'll take a break, be back with more right after this.